you know what Down syndrome is? Are you aware of the importance of Down syndrome? According to my audience analysis, the class has some awareness of Down syndrome. There are some class members that aren't too sure about the topic at all. Today, I'm going to give you some important information for those who have no idea about Down syndrome and maybe add some to the class with to their prior knowledge. I have the pleasure of working with people with Down syndrome. It can get a little frustrating, but overall, it's rewarding. Down syndrome is a genetic disorder that is caused when there is an abnormal cell division leaving a person with an extra or full chromosome. The extra chromosome causes developmental changes and some physical features. It can cause lifelong intellectual disability and development delays. Down syndrome is the most common genetic chromosome disorder. It causes learning disabilities in children. It causes medical abnormalities, which parts of the body, such as your heart and your gastrointestinal disorders. Not all people with Down syndrome look or act the same. Some have behavior issues and some may not. You have people with Down syndrome that are healthy and some with serious heart defects. Children and adults with Down syndrome have a distinct facial features, but not all people have the same features. Some common features associated with Down syndrome are, but not limited to this list. They can be a flat face, small head, short neck, protruding tongue, poor muscle tone, short in height, unusually shaped or small ears, slanted eyelids, short fingers, small hands, and even small feet. Infants with Down syndrome may be average, but will grow slowly and remain shorter than children of their age. The risk factors associated are advanced maternal age, typically women over the age of 35, parents being a carrier of the genetic translocation of Down syndrome, having a child with Down syndrome already. There are a variety of complications. Again, gastrointestinal defects, heart defects, immune disorders, sleep apnea, obesity, dementia, spinal problems, and even leukemia. People are expected to live more than 60 years depending on the severity of your health problems. There is no way to prevent Down syndrome. If you are at a risk of having a child with Down syndrome or already have a child with Down syndrome, it's best to consult a genetic counselor before becoming pregnant. If you're thinking about having a child or you have concerns, I would advise you to get the genetic testing that you can get prior to becoming pregnant.
You just gotta look at the audience again.